Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered. And in last week's episode, I answered another question in this series of questions from our client, Robert. The question last week was part 5 of my 68-year-old mother is in intensive care with gastric perforation and she's not waking up after the surgery. Will she need a tracheostomy? You can check out last week's episode by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer the next question from my client, Robert, which are excerpts from email counseling and consulting sessions with me. And the question this week is part 6 of my 68-year-old mother is in intensive care with gastric perforation and she's not waking up after the surgery. Will she need a tracheostomy? So, Robert continues with his mother's situation below. Robert writes, Hi Patrick, here is another question. Right now, I don't believe they are giving her any pain medications at all to help increase the odds of waking up. Is there any risk that she goes into shock or something like that? Should she be on some pain medication? A few days ago, they were giving her a light pain medication that doesn't cause sleepiness, but they stopped that as well. We don't think my mum is in pain. She actually looks quite peaceful and comfortable. The doctors are planning to perform the tracheostomy and the PEG tomorrow. I will keep you posted and I'm sure I'll have a few more questions. Thanks from Robert. So, here is my response. Hi Robert. I would imagine that not giving pain medications is due to them wanting to wake up your mother. You are correct. Normally, in intensive care, the doctors and the nurses will assess your mother's pain status while she's unable to communicate properly through non-verbal pain assessment tools, as well as asking simple yes and no questions. If she's not ready to answer yes and no through nodding or shaking her head, they will simply assess her non-verbal responses. Also, they will have a good idea in how she's going with pain, depending on how well she can breathe on the ventilator. For example, a sign that she has minimal or no pain is that she's breathing with a normal respiratory rate, which means breaths per minute, as well as breathing with good tidal volumes, which is the volume in mils per breath. And they will also be monitoring her minute volumes, which is the breathing volume in mils per minute. And they must be adequate for the size of her lungs, which is measured around her body weight. This would also show up in her arterial blood gases, where a low CO2 or carbon dioxide would show up for hypoventilation as a sign of pain. If she's not in pain and breathing fine, she will have a normal arterial blood gas. Therefore, taking her off the pain medications such as fentanyl or morphine makes sense from my perspective, especially since those pain medications are long-acting and also addictive. After nearly 1 month of being in and out of an induced coma, as well as being on and off ventilation, the sooner they can rid the morphine or fentanyl, the better. I'm sure they would be giving some light pain medication such as Panadol or paracetamol, or even small doses of morphine in tablet or sachet form. I do strongly believe that if they can stop the pain medications, it's a good sign as long as she can tolerate it, of course. But also important in all of this, what do you and your family think? Do you think your mother is in pain? As long as she's not in pain, There's no risk of shock, and I would imagine that an experienced ICU nurse or experienced ICU doctor can recognize a patient who has pain with some nonverbal pain assessment tools. If pain, of course, goes unmanaged, it can certainly cause harm, but I do have trust and faith that the staff can recognize it with their assessment tools. I hope that makes sense. Any more questions, please let me know. And here is then Robert's response again. Robert writes, "Hi Patrick, one decision the family needs to make is on what level of intervention we would like the medical staff to do, not directly related to today's tracheostomy, but just in general. And that would be number 1, dialysis for kidney failure, and number 2, chest compressions, much beyond general CPR, which they always do in case her heart stops. We've heard that chest compressions are a final, desperate measure and all sorts of other things are going wrong at that point, and that it's an aggressive, even violent activity at times. What's your take? What do most family do? Many things." From Robert. So here's my response to Robert's question. Now, Robert, as briefly outlined in one of my previous emails, definitely yes to dialysis for kidney failure and yes to cardiac compressions. Most families in intensive care opt for full treatment. Treatment limitations are usually something that the intensive care team is driving for a number of reasons. In rare cases, families opt for treatment limitations, and sometimes when treatment is being quote-unquote futile, which means of no benefit to a patient, and I should say of no perceived benefit to a patient. If there's a mutually agreed treatment limitation plan that can be agreed upon, that's fine, but it needs to be mutually agreed on. From my perspective and from all the information that you have shared with me, I see every treatment your mother has been given and may need in the future as of benefit for her. You and your family can always revisit this if the situation changes, and the intensive care team are usually the first ones to make you aware of it, and I believe they have already mentioned this. For now, with your mother's heart beating strong, it also makes it less likely for her needing the dialysis. Dialysis is needed for kidney failure, and kidneys can fail in ongoing severe sepsis and during prolonged low blood pressure. And people with diabetes also have a higher risk of needing dialysis for kidney failure. The sepsis she seems to fight okay for now, and therefore hopefully she won't need dialysis for kidney failure. With the heart beating so strong so far, unless there is a heart condition that you haven't mentioned, I would strongly advocate for cardiac compressions or CPR. And CPR stands for cardiopulmonary resuscitation, especially in light of the fact that the ICU team has mentioned withdrawal of treatment at some stage already. By you stating that you want full treatment including cardiac compressions, you are keeping all of your options open thus far, and you are showing the team that withdrawing treatment at this point is not an option for you and your family. And as you have correctly pointed out already, you can always change your position down the line. One of the recurring themes in intensive care, as well as for our client base, is that if anything, intensive care teams can be very quick at wanting to withdraw or limit treatment. This, from my perspective, happens way too often and also prematurely. A lot of work is coming from helping families when the intensive care team is trying to push towards a withdrawal of treatment, often without family consent. This often early push towards withdrawal of treatment from intensive care teams happens for a number of reasons, including financial budgets, lack of ICU beds, staffing issues, medical research interests, and the list goes on and on. We can help families very quickly to position their loved one's diagnosis, their prognosis, as well as their care and their treatment that helps families to get the outcomes that they want. Also, in light of the fact that your mother currently is only on one major life support mechanism, which is the mechanical ventilation, I think she's in a fairly good position to get through this challenge and leave intensive care alive. You are also correct to point out that cardiac compressions are a final desperate attempt to save a life. However, if there is any environment where people are well trained and have all the equipment and resources to deal with such a situation, it is an intensive care environment. Yes, I agree that survival rates are not great after cardiac compressions. However, people still do survive. I also feel like 69 years of age is not very old. People above the age of 80 get resuscitated in intensive care all the time. Some of them do survive. Another component would be if you and your family have discussed this issue with your mother in the past. What do you think she would want? I do strongly feel that opting for full treatment and also for full resuscitation in case of a cardiac arrest, you and your family are very safe to keep this option for now. I do believe it's very important from a bigger picture point of view that the intensive care team knows that you want to stay in control of your mother's destiny as much as you can. I hope that helps, Rob. Let me know if you need further clarification of this topic. Maybe you can tell me tomorrow how the PEG and the tracheostomy went. So, how can you become the best advocate for your critically ill loved one? Make informed decisions, get peace of mind, control, power, and influence quickly whilst your loved one is critically ill in intensive care. You get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free instant impact report now by entering your email below. In your free instant impact report, you learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free instant impact report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free instant impact report now by entering your email below. In your free instant impact report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care, and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability, even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care. And it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also check out our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Or you can call me find international phone numbers on our contacts tab. Also, check out our ebook section where you get more ebooks, videos and audio recordings, and where you can also get one-on-one counseling and consulting with me via Skype over the phone or via email by clicking on the tab on the top of the website. This is Patrick Hutzel from IntensiveCareHotline.com, and I'll see you again next week in another update.